The U.S. Surgeon General is raising a red flag when it comes to alcohol and cancer risk. He's calling for a warning label on alcohol similar to the one on cigarettes. King 5's Madison Wade has the details on what triggered this warning. And I mean, how soon are we talking about this label?
Well, it could take some time, Greg. That change would need to be approved by Congress. A doctor I spoke with says that putting out an advisory like this, though, is always helpful because it gets the general public talking about making healthier choices. While many are partaking in dry January, there's a new warning from the U.S. Surgeon General about the link between alcohol and cancer.
When it comes to cancer risk, less drinking means less risk.
U.S. Surgeon General Vivek Murthy wants Americans to know alcohol is the third leading preventable cause of cancer. It follows tobacco and obesity.
We've had more and more evidence that keeps accumulating year by year that's giving us a strong connection, a causal link between alcohol and cancer.
The Surgeon General says there are links between alcohol and 7 types of cancer. He wants to add this reminder to warning labels already on hard alcohol, wine and beer.
I think it acknowledges reality that we have long believed in, which is that alcohol is not safe and that it does pose some side effects that could be injurious. But just like with everything else, there's pros and there's cons.
Dr. Vin Gupta says drinking in moderation while living a healthy lifestyle should not be cause for concern.
Occasional drinking is ultimately not going to significantly impact your quality of life or your health span. And I'd argue it actually could create for positive health impacts as well, especially when it comes to heart health.
According to the top doctor's advisory, alcohol consumption is to blame for nearly 1 million preventable cancer cases in the U.S. over the last decade. Furthermore, about 20,000 people die every year from those alcohol-related cancer cases. This advisory comes at the same time the government is working to update dietary guidelines. Those are expected later this year. Right now, it recommends women should limit alcohol consumption to 1 drink or fewer per day. Men should stick to 2 or fewer.